My name is Brad Stevens, and I am one of two 2009 fellows at New Alternatives for Children, a Manhattan-based health and child welfare agency. New Alternatives for Children was founded on the belief that all children, including those who are chronically ill or physically challenged, have the right to live in safe, loving, and permanent family homes. In 1982, armed with little more than this conviction, $100,000, and a 1,500 square foot office, Arlene Goldsmith set out to provide permanency to a handful of New York's border babies, the drug-exposed, HIV-infected, and disabled infants that overflowed the city's hospital wards. Recognizing that the vast majority of these children were unable to return home due to the demands their special needs would place on their poverty-stricken families, Dr. Goldsmith adamantly believed that many birth families would welcome their children home if sufficient supports were provided. She insisted that there were families in the community willing to foster and adopt these children when they had no family to which to return. Dr. Goldsmith was correct, and the rest, as they say, is history. For 28 years, NAC's services have enabled thousands of the city's most vulnerable children to live in permanent, safe, and loving homes, either birth or adoptive. In 2009 alone, NAC's efforts touched the lives of 1,168 children and 595 families. To date, New Alternatives for Children represents the only child welfare agency in the New York metropolitan area that exclusively serves medically fragile children. Its level of experience and expertise is simply unparalleled. Executed by a dedicated team of social workers, healthcare professionals, and education specialists, NAC's innovative services ensure that the physical, social, psychological, and educational needs of medically fragile children are met. Since September 9th, I have worked as a case associate in NAC's foster care and adoption program. Established in 1987, the foster care and adoption program is charged both with a complex and delicate task: to achieve permanency for medically fragile foster children as quickly as possible, either through reunification with their birth parents when safe and feasible, or through adoption by their foster parents. In the role of case associate, I am responsible for supervising agency visits between foster children and their biological parents, assessing the well-being of children in foster home placements, connecting clients with mental health and social support services, and assisting in the development of service plans and family team conferences. I knew that I loved my job when about 3 months ago, a 4-year-old named Troy, who was in the throes of a tantrum, spat a mouthful of partially masticated chicken McNuggets into my face, and I not only showed up at work the following day, but was oddly excited to do so. All joking aside, the past 6 months have been an extraordinary experience, and I am honored to call myself a member of the NAC family. It is my honor and privilege to introduce Dr. Arlene Goldsmith, Executive Director of New Alternatives for Children, and to award her a certificate of appreciation.